Good morning. I'm very excited to be here for this announcement. It's fantastic that President Calderon and his wife and all the other leading officials are here to make sure this gets off to a great start. One of the reasons I'm thrilled about this project is the group of partners that we pulled together. First is the government of Mexico. The government of Mexico has been a leader in a number of health initiatives, whether it's using the payment systems like Progresa or Oportunidades to encourage good health behaviors, or whether it's the more recent childhood health insurance program, which has made this country a leader in getting the latest vaccines out to everyone. Those are fantastic things, and the kind of expertise that's driven that work will be very important in this project. We're also thrilled to be working with the government of Spain. Government of Spain has increased its aid over the last 5 years quite significantly, and we've had the opportunity to partner with them in a number of areas, including some breakthrough work on malaria. I'm thrilled to be partnering with Carlos Slim through his Health Institute. It's actually the first significant partnership we've done together, but I'm sure it won't be the last. And his group brings a lot of expertise and experience in these countries that will be very important. Finally, the Inter-American Development Bank has expertise in terms of how this program will be pulled together financially, getting these countries to work together that will be absolutely critical. So we do have an excellent group of partners. Why the focus on health? Well, health to me is the first priority. The foundation that my wife and I run spends the majority of its funds on improving health for the people who are in the greatest need. And the opportunity to save lives, to improve lives, and to allow people to achieve in school, to not be out of their jobs. The impact of improved health is very, very dramatic. The world is now more focused on these problems than ever. For example, we have the Millennium Development Goals that include clear measures of reducing maternal and child mortality. We have incredible progress. For example, maternal deaths 30 years ago were over 500,000 a year. Now they're less than 350,000. So that's over a 30% reduction. However, we know there are interventions that can reduce those numbers far, far more. In childhood deaths, if we go all the way back 50 years ago, that was 20 million a year, and now we're down to about 8 million a year. So that's huge progress. A big part of that is birth practices and using new vaccines. And so those are a major focus of this program. If we look at the poor people in the regions that the initiative is focusing on, their health statistics are much worse than the average in the world. And so we know that there's a lot of room for improvement. When you think about this project, you don't need to think about an expensive hospital with an expensive equipment. What you need to think about instead is educating mothers, educating them about exclusive breastfeeding, providing some very inexpensive drugs so that if you have early problems with infections or bleeding, that you can stop those very quickly. Think of training community health workers so that they can recognize symptoms and intervene in the right way. Think of the greatest tool in all of medicine, which is the vaccine, where a child receiving 3 doses of a vaccine is prevented from getting the disease for their entire life. And so the projects we have in mind here are based on proven models, and we will be able to measure exactly what happens. Each of the countries involved have some best practices that we'll be able to benefit from. The program will continually learn in terms of what's working. It may be that to reach particular communities, it has to be done by organizing the women in a slightly different way than in another community. And so the depth of expertise, the commitment to admit when things aren't working and adjust those things is an important part of this project. So our foundation is firmly committed to this work. We're increasing our investments in this area. We hope that other donors will do the same. It's a tough time in terms of donations for aid. Many countries, as they look at their budgets, are cutting those back. But in fact, the ones that should be preserved and even grown are these incredible interventions in health. Because when we think about the great state we want all of these regions to be in, one of the most necessary elements are these improvements in health. So again, I want to thank the partners for their involvement and say how thrilled I am and committed I am on behalf of the Gates Foundation to this work. Thank you.